All right, good afternoon, everyone. My name is Rose Spickler. I'm the membership manager of the Lakeshore Sustainability Forum and the West Michigan Sustainability Forum, Sustainable Business Forum, excuse me, and I am pleased to welcome you to today's webinar. For those of you that are not familiar with our organization, the Lakeshore Sustainability Forum is a regional program of West Michigan Sustainable Business Forum. We serve as a platform to connect and collaborate on sustainability interests and highlight its potential as an economic driver and a defining feature of the Lakeshore as an economy and as a destination. We do this by providing education, resources, and collaboration opportunities to businesses, individuals, and institutions throughout the Lakeshore region. Today, we're excited to present a webinar on health equity and social justice along the Lakeshore. We would like to thank the Community Foundation for Muskegon County for their partnership in developing and hosting this event. If you find this program valuable, I hope you'll join us for some of our upcoming online discussions. We are hosting a series of congressional member roundtables and forums on resiliency and sustainability throughout August and September. The roundtable for the West Michigan Lakeshore with Bill Huizenga will take place next Tuesday, August 18th from 2:30 to 3:30 p.m. We welcome all of you to join us. A link for the registration for that event will be available in the email that is sent out with the recording of this program later today. Lastly, the forum will be hosting the Michigan Campus Sustainability Collaborative's Earth Day 50.5 event on October 22nd, which is a statewide virtual conference recognizing the 50th anniversary of Earth Day with learning and action for students, faculty, staff, and alumni on college campuses across Michigan. You'll receive a link to today's program with a feedback survey along with any additional notes that come out of today's program in an email following this webinar. This series and all of our programs are primarily funded through membership donations. If you are not yet a member of our organization, please consider becoming one. We offer both individual, student, and corporate memberships. I would like to recognize some of our new professional members, including Kelly Goward, Kayla Musil, and Sarah Trandu. You may also be interested in learning about our various working groups, including the Lakeshore Sustainability Task Force, which meets every other month. The Lakeshore subcommittees include recycling and composting improvement, industry, and equity and environmental justice. If you're interested in any of those, please let us know. You may also be interested in the Forum Sustainability and Equity Working Group that will meet next Monday, August 17th from 3 o'clock to 4 p.m., among others. Please email us to get involved with any of our working groups. Now I'd like to introduce our moderators who will then lead the discussion for our program today on advancing health equity and social justice. I'll now pass it over to my colleague Carissa Patron, Equity Program Manager for the Forum, and Jocelyn Hines, Program Officer for the Community Foundation for Muskegon County and founder of Muskegon Young Black Professionals. Jocelyn?
Good afternoon, everyone. Like Rose stated, I am Jocelyn Hines, Program Officer for the Community Foundation for Muskegon County and founder and current chair of Muskegon Young Black Professionals. I am excited to be here and co-moderate today's webinar with Carissa. As a Black woman and community member, health equity is important to me and a topic that is timely considering the disproportionate impacts of COVID-19 on our Black and Brown communities. I am so glad West Michigan Sustainable Business Forum and the Community Foundation for Muskegon County partnered to host this important topic.
Hi everyone, I'm Carissa Patron. I'm the Equity Program Manager for the West Michigan Sustainable Business Forum, and I'm glad that you all are able to join us today for our webinar on advancing health equity and social justice along the West Michigan Lakeshore. So first of all, I wanted to extend my appreciation to all of you community health workers on our panel today and in attendance today. For today this month has been recently named Community Health Worker Appreciation Month by Governor Whitmer for the month of August. So I would like to extend my appreciation to you all today. So today, we will center our discussion around disproportionate impacts from COVID-19 along with racial justice in a conversation that really elevates the need to work collectively to address both historical and systemic inequities, not only in our businesses, but in our institutions and communities as a whole in Muskegon County and along the Lakeshore. So today I have the privilege of introducing our dynamic panelists today, including Angelita Valdez, who is the CEO and owner of Servicios de Esperanza and leader and organizer of Latinos Working for the Future, along with Alexis, who is the Communications and Development Manager for Hackley Community Care, and also part of the Muskegon Health Disparities Coalition. Kathy Moore, who is the Health Officer and Public Health Director for Muskegon County, And last but not least, Julia Roop, who is the Executive Director for Health West. I would like to thank you all for joining us today. I really appreciate you taking some time out of your day to have this conversation with us. So for our attendees, please note that you can share your thoughts with the panelists or all attendees by using the chat function. You can also post questions through the Q&A field as well. So we have time at the end of the conversation for questions and answers from our panelists. So keep thinking about those for the moment. So now I'd like to pass it along back to Jocelyn, who will be helping me to co-moderate this panel today.
Sorry about that. My internet connection is unstable. Okay, our first question here. Before we begin, would you mind sharing a bit about the work that you do in our community and how your organization has responded to COVID-19? Kathy, we will start with you, and we would like for you to share some current numbers in the state of COVID-19 in Muskegon County.
Thank you very much, Jocelyn. I am Kathy Moore, the health officer for the jurisdiction of Muskegon County. As the health officer and the public health director, our primary role is to enforce the Michigan's public health code. And our goal is really to help prevent diseases, promote healthy behaviors, and protect the environment. Different than a direct healthcare provider, public health, our job is to protect individuals outside of just the individual healthcare treatment. So sometimes if I issue an order either for a test or exclusion from school or to shut down a restaurant, it is actually to protect the public, not necessarily the person that it directly impacts. So here at Public Health, we have staff on hand responding to the COVID crisis locally. Our primary work here is investigating positive cases, primarily to identify close contacts, to talk to those close contacts, quarantine them, to isolate positive individuals with the overall goal of trying to stop or mitigate the spread of COVID-19 in Muskegon County. Our numbers, our most current numbers as of yesterday morning, total cases of 1,133 cases, total deaths 58, and we had another report of deaths this morning. Of the total cases, gender, 41% or 464 are male, 59% or 668 individuals are female. As it relates to race, 51.7% or 586 are white, 34.1% or 386 are Black. We've recorded 5 individuals COVID positive as American Indian, 1 as Asian, 74 as other, and 81 as unknown. Also, for ethnicity, we've recorded 105 individuals as Hispanic Latino. So speaking to disproportionate, 34.1% of the positive COVID-19 cases in Muskegon County are Black residents, and 9.3% or 105 are Hispanic Latino. Both of these percentages are higher than the percentage of our general population, which indicates that COVID-19 is disproportionately impacting our Black and Brown community. When we break it down by municipal location, the Muskegon Heights, which is majority Black, even though the demographics are changing, 155 of the cases, or 13.7%, are located in Muskegon Heights, and 32%, or 362 of those cases, are located in the city of Muskegon. And then I'll move to deaths. So of the 58 deaths that was recorded yesterday, 16 of those were Black, which is 27.6%, and 2 were Hispanic Latino. I will stop there. Thank you, Jasmine.
Thank you, Kathy, and thank for all the work that you and public health are doing in the midst of everything that's going on. Alexis, would you be willing to share next and share about the disproportionate impacts of COVID-19 in your line of work?
Sure. So Alexis Dye, and I serve as the Communications and Development Manager for Hackley Community Care, which is a federally qualified health center. We have clinics in Muskegon Heights and the city of Muskegon. We also operate an integrated health clinic with Health West, and we're in about 15 schools providing school-based health services. So we serve that population that is uninsured, underinsured. Primarily Medicaid is our primary audience, of course. And so, of course, these are the population, again, that most disproportionately being affected by COVID-19 as well. So some of the things that we've done, we had to have a quick response when this came on suddenly, and a lot of that was adapting to technology and adding telehealth. We had kind of looked at and explored it, but we weren't doing much of that. And so we stayed open through the pandemic, although, minimal hours and only emergent services, but we expanded telehealth to be able to kind of engage and have those appointments with our patients. And they were also able, if they thought they were symptomatic, so they could have that video conference or phone call if necessary, if they didn't have the technology to do it video by face, to have those symptoms diagnosed and see if they needed to, see a doctor or be tested. And then we also added drive-up service to test our patients, so that if they were positive and the diagnosis up, they could come directly to us, have their test done, and then, without having to get out and enter the building and things like that, and for those results. So that's kind of what's affected us. The Health Disparities Coalition, on the other hand, has been looking at some things of what we can do. We've been talking health disparities for over 10, 12 years. So for us, this is right in our arena, because we've been, like I said, working at this initiative for quite a long time. So we do know that it's going to take some different kind of messaging to reach that population, and understanding that population in order for them to be more compliant and to take this seriously. Thank you.
Thank you, Alexis, and thank you to the Hackley Community Care and Health Disparities Coalition for all of your work. Angelita, would you like to share a bit about the work that you are doing surrounding mental health? You can also talk about some things that Latinos Working for the Future are doing around this disproportionate impacts of COVID-19 as well.
Sure, thank you. Good morning, everyone. My name is Angelita Valdez, and I'm the proud CEO and owner of Servicios Esperanza, known in Muskegon County as Services of Hope. We have 2 offices here in Muskegon and 1 in Oceana County. And we have been providing services of behavioral health and outpatient mental health and outpatient substance abuse services throughout the pandemic, which, like Alexis, it's been very unique in that we've been able to be open this entire time through telehealth services and being able to provide those services, but also for children. We have registered play therapists and trauma-focused CBT therapists here in our office. So just teaching the community and teaching other providers locally how to provide telehealth for play therapy and for children online has been very interesting and unique for our office, so that way we can use our talents and our treasures here as well. And for Latinos Working for the Future, just bringing that voice. Having things that were translated into Spanish for the Spanish-speaking community from Muskegon County, and also having things like ethnic-based food giveaways. And when we think of a food truck or a food giveaway, there's a lot of dry foods like macaroni and cheese and things like that. There are not a lot of things that our community necessarily have in their home. So making sure that we were having ethnic-based food giveaways, along with promotion of materials. Muskegon County does not have a language access plan, and so for Latinos Working with the Future, it was very important to get those that information and the materials translated into Spanish, so that way we were doing our part for our community. So very blessed. We're excited to do the work, and we look forward to continuing to move it forward.
Thanks, Angela. Thank you for all the work you and your organizations you are a part of are doing as well. And finally, Julia, I'd like to invite you to share a bit about the work you do in Health West's response to COVID-19. You're muted, Julia. There we
That's
go.
helpful. How's that? Thanks. If you're not familiar with the work that Health West does, we're the Community Mental Health Program, one of 46 in the state of Michigan. And by definition, we're required to provide services to people with serious mental illness, adults and children, substance use disorders, or intellectual and developmental disabilities. That's what most people know us of, and we've been around for a long time, 50 years, to provide those services. In the last 5 years, we have evolved a bit, and we are now a certified community CCBHC, a certified community behavioral health clinic, and that is a federal recognition of CMH, and it requires that we've expanded our services quite a bit. So now we provide quite a lot of prevention and early intervention services. It used to be you had to be eligible for our services. Now anyone can get services, regardless of your ability to pay, what you're looking for, what kind of help you're looking for, what kind of insurance you have. So we're open to the entire community for the whole range of services. That's really important during this time because we want to be available to people that are and responsive to people in the community that may not be open to our services, but maybe didn't know who to reach out to before. We're regarding our work with prevention and early intervention, a lot of people know us by the partnership and the work that we've done with other community members, people on this panel, around the adverse child events work, which talks about the experience of children that have experienced violence, abuse, neglect, loss of parent, etc. And the impact of that, the higher the ACEs score, the more the worse their health outcomes will be. I mentioned that as a specific project because some people are familiar with it, and also because I think it has some lessons learned for what we're going to be talking about today in dealing with chronic stress. Another thing that we do in the prevention arena is provide psychological first aid, and we offer that free to businesses or individuals, families, individuals that have experienced a traumatic event. Got a lot of those happening around us right now, and this is an evidence-based practice. We can send an individual to go out and try to help reduce or mitigate the impacts of that traumatic event. It's a brief intervention. And so, like lots of other people, as Angelita and Alexis have described, we have changed our services model a bit in response to COVID. Initially, we moved to only essential services. We expanded telehealth dramatically and quickly. We have about 350 staff. About 250 were doing telehealth, just to kind of give you. And prior to COVID, about 20 were doing telehealth. So we very quickly moved in that direction. We also, like everyone else, we remained open the entire time for essential services. Currently, we're at what we call our phase 3 in the reopening. We use the data from the health department to tell us what phase that we will be in. And so most of our teams are responding in person in the community. Individuals can walk in for services right now. They can also access services through telehealth. We did also add some services as a result of COVID. We were fortunate enough to get some federal money to help us do that. We have implemented a warm line that's still in the beginning stages, but this is something here to stay. And basically, any member of the community can call 722-HELP and request services, request help, request psychological first aid, or just talk to somebody, sort of along the line. And that's why the term warm line, if you just feel like, hey, I just need to talk to someone right now, and that's available. Right now, we're using a service off hours, and we are answering the phones ourselves during the daytime. And as soon as we get our phone system upgraded, we'll change that to us directly answering the services. So people in the community, 24 hours, 7 days a week. We also provide mobile crisis 24/7. We will go out and respond with the police. As part of COVID, for example, we gave some police departments iPads so that they would have them in their cars and they could contact a mental health worker directly if they were on the scene and needed some assistance. So those are a number of things we've done. We've also placed them in some homeless shelters and other provider locations in order to access those services very quickly. And we're still doing that if there's other places interested in that. And lastly, just to mention that we've tried to partner with our fellow county department. We are a county department, Health West is, of Muskegon County, as is the health department, and support testing and contact tracing. We tested over 1,000 people in our adult foster care system and room and board situation, because as we'll talk more about later, not only are persons of color overrepresented, but our population. In April, the clients we served were about 10% of the people that were showing up positive, COVID positive, which is way overrepresented. That number has dramatically changed in the last few weeks, so that's good news. And so we've been assisting with testing, community testing. We have another event we're planning on the 28th for our neighborhood and our clients and anyone who wants to come. We're still working on the testing piece, but it's also going to be a voters registration drive. So those are some of the things that we're doing in regards to COVID. I'm certain that all of us as providers will never quite return to the way we did business before. And some really good things are going to come out of this, I believe.
Thank you for sharing, everyone. You have a lot of great insights and wisdom to be shared. So in June, Health West recently declared racism and social inequities as a public health crisis. Along with on August 5th, Governor Gretchen Whitmer also recognized racism as a public health crisis as well. So Julia, I was wondering if you could expand a little bit on that and what led to that decision and what changes you might foresee moving forward.
Well, I think that, you know, I've always been very proud of the work that Health West has done historically since I've been here as director, and I'm sure before me, in the area of increasing cultural wellness, making sure we're building cultural competence in the services that we provide, and particularly in the work that we've done in building resiliency to address the chronic stress in our community, especially around the ACEs work that I mentioned before. But clearly the world was telling us we needed to do better. And I felt, probably like a lot of you, I needed to do better. So Health West leadership, you know, we were feeling the despair and the anger over the killings of George Floyd and others making the headlines. And at the same time, we were feeling a lot of chronic stress ourselves as we were in the middle of the pandemic. And we were, and Kathy, I think very boldly was starting to publicize the results of who was testing positive. And so we were seeing that people of color were overrepresented in the COVID positive population. Back in March, I remember I had a conversation with Kathy Moore. We were part of several community groups talking about this, and we were quite surprised at the number of educated people that we had great amount of respect for who were asking the question, why are people of color overrepresented at COVID positive? Like, what, you know, they were surprised by it. They wanted an explanation. And I just remember feeling there's so much research out there, and Kathy and I talked about this. We already know that race is an indicator of health disparity, not just low socioeconomic status, but race itself. So why would we be surprised to see these numbers? So it really felt like, you know, systemic racism has existed for generations and has created this chronic stress on persons of color. Science tells us the impact of chronic stress isn't only related to our emotional status, and of course our emotional status is related to our physical status and vice versa, but it also affects, it increases our chance of heart attack, a stroke, our gastrointestinal system, our endocrine system, our immune system. It changes our disease behavior. We know this through research. So we felt we had to make a much stronger, a much louder statement about, specifically about the impact of racism on persons' physical and mental health. And further, we knew we couldn't just make a statement. A lot of people, frankly, were making that statement. We had to put a pretty solid action step behind our declaration. That chronic stress of institutional racism continues to take this toll. And so our action steps are not only around how do we address implicit bias, how do we increase cultural awareness, how do we be leaders in this area, but also, and how do we help address the systemic racism, but also what is our duty and what are we going to do to build the community resiliency to protect ourselves against the impact of this chronic stress.
Thank you for sharing. And for Angelita, Alexis, and Kathy, how have you seen, if that the current movement for racial justice and kind of this upheaval of racial consciousness has impacted or shifted your work in any way? Alexis, you're muted.
Sorry. So for Hackley Community Care, equity is always at the forefront of what we do, especially because of the population that we serve. So, the social determinants of health, if it's, serving the whole patient is, part of our motto when it comes to their mental health, their physical, socioeconomic status, all of that. We always take those social determinants of health factors, into consideration. So we have a DEI work group that looks at these initiatives and makes sure that we're, our policies and things are in line and that we are serving our patients under, with quality, integrity, respect, and all those areas. But when those things happen, particularly with George Floyd, we had to kind of take a step back because we found out that as the leaders, our D&I group was really experiencing its own trauma. There was anger, there was just a heaviness and fears. And so what we did was take a step back and created some safe spaces for the leadership, DEI leadership team themselves, and for staff to be able to come together and have discussions about that, be it that you needed to get the frustration, or if you needed to cry, or, whatever that emotion or those things were, was to do that and for people to listen. We spend all of our time with each other as a family, so we all need to be able to respect that and be able to support what everyone's going through. So that was, and I think it's something that's continuing. I think that was a great outcome for us, to kind of step back from just the data-driven and, outcomes measures, and to really focus on the staff and how this is impacting them.
Yeah, I think that's a really important point to make. Thanks for sharing. And Kathy and Angelita, do you have anything that you'd like to share?
I would say for our office, we have the privilege of having a platform for clinicians of color. So just taking that step back to see where we were personally and how it affected our communities and our families and our households, and then bringing that to our clientele. On one hand, we have, again, the privilege of being clinicians of color to identify and to have those feelings and that hurt and that anger. But then on the other hand, also educating our non-clients of color to say, hey, this is an issue because, or this is something that we live through every day. It's not those people or in those communities, it's our community and my household. Every day I have to do things differently just to go to work or to be heard or to be invited to the table. And so again, a blessing in disguise in terms of being able to have those conversations in a sensitive, hopeful environment, and then also moving that work forward. I also think of things like promoting self-care for our staff and families, and what this pandemic and the these racial inequalities have brought to light. When we think of simple things like forms or your income taxes or your health forms being translated in a language that you understand, or having a space where there was free COVID testing for our community, but if you're not an English speaker, how you were accessing that. And it wasn't until 30 days later, 2 months later, that those networks were changed in order to be inclusive of those types of communities and the others that we needed. So we still have a lot of work to do, but now it's at the light and the forefront, and we're working collaboratively and having these conversations in an open forum.
Thank you for sharing all of that with us. And Kathy, is there anything that you would like to add to this question? All right, I'll pass it along to Jocelyn for the next question then.
Okay, thank you all for those answers. Our next question is, and you all can answer this in any order that you see fit. What do you see as the intersection between health equity and social justice? And as you construct your answers, also think about what are some of the social and political determinants of health and inequities that continue to have a large impact on communities of color here in Muskegon County.
So, okay, I will start.
Go ahead, Alexis.
So I think we're really, I think, first of all, starting to hear from, local government, state government, making these clear declarations, that racism, is a problem. Of course, we have the governor's proclamation on that. The county also adopted a resolution renouncing bigotry, hate, and also affirming, that the interconnectedness of what we, that we are all, suffer, as a result of racism and systems that have been in place for so long that seem to, suppress people, from just having, equality in every area of their life. So I think establishing those kind of things, the Black Leadership Advisory Council that Governor Whitmer also has established that requires implicit bias training for healthcare licensure and regulations are some of those other intersections that are going to be crucial going forward as well. Disparities due to those structures and institutions are what build our country and our society. So, food, safe housing, affordable housing, all of those things are, just crucial, necessary, that most of us take as just, a given. And it's not so fortunate for others. So I just like when we think about, equity, as the absence of avoidable or remedial differences among groups of people, whether those groups are defined socially, economic, demographically, or geographically. And when you talk about equality, it's when every individual, regardless of race or gender, their class, they have equal access to all the same resources. So that intersectedness is, being able to connect all of those so that everybody equally has the same thing. And I think for us as health professionals, sometimes there's, it's hard to try to understand the specific needs of people of color. So those persons of color don't always feel heard or understood, or that they're not listening to me. And I have a lot of conversations with people from all kinds of, different professions or whatever. And it's really common for people to say, well, I don't see color, or, I just don't know what to do, or, but, I just don't see it, I don't understand. So the thing is, if you're caring for people and you don't see color or you don't see race, then that is a problem. And that's the thing that we need to dispel, because that's how you obtain trust. And people are very sensitive and understand when you're really caring, and if they can trust you to care for them and give them the best care that that they're seeking and that they need based on their needs. So that means knowing the person, his relationship, understanding the culture, and not being afraid to, just to implement yourself to, move forward by asking and getting to know so that you can provide the best care.
This is Kathy Moore. I think I was double muted earlier, so I think I figured it out. I think some of the intersection between health equity and social justice is really looking at policies and practices. And, many years ago, we had this movement and platform called Health in All Policies, where we would look at organizational policies to just assure that they're incorporating a health component that is inclusive of everyone. I think all of these organizations and government entities that are making these resolutions and declarations, have to take it further than the resolution and declaration and change the way they do business. They have to look at their policies and processes and the way they evaluate grant making or even service eligibility to assure that they're not leaving out individuals who have really good potential, but maybe at different levels of readiness to participate. Too many times we set these guidelines and standards, and a lot of the guidelines and standards are established to assure that people don't abuse a system or they don't abuse a resource that's available. And the reality is there's a very small fraction of individuals that actually set out to get, extra food that's handed out or an extra month's payment. So I think part of that intersection has to be, how do we meet people where they are and help fulfill the mission without putting all these barriers that's been used historically to deny access. That's it for me.
I think I would add, we have to be careful. Equity access does not equal equity, right? We've had some policies, Medicare, Medicaid, they've enhanced the Medicaid expansion, have dramatically enhanced access to healthcare. But still, the people that we serve can't find a physician to treat them, or they go to the ER and they're sent away because they're not heard. They give other reasons for their behaviors, or they attribute it to their mental health issues or other stressors going on in their life instead of the real physical complaints that they're presenting with. So
I agree,
go ahead,
Julia. Yes. Oh, I agree. I think there are some physicians who have sort of a stereotype and think that when working age minorities present with an illness that they may be looking for a doctor slip or an excuse not to work. And that's very frustrating.
One of the main reasons, thanks Kathy, one of the main reasons that Hackley Community Care and Health West run a joint integrated healthcare clinic is that the primary focus of people in that clinic in the first place are people that would not be seen by any other physician, right? And that had to do with these other social factors that we're talking about. So I think that intersection of, we know, again, we know these things to be true, and yet we still keep repeating our same behaviors, right? Our organization, and I think one of the things that I realized through all of this is that as important as this work is to me, and I've done it for 30 years, and I'm very passionate about it, still not getting it right. It's really frustrating to me, right? I'm still not getting it. So, and I'm a white privileged woman, right? So I'm not gonna think, Angelita, about, oh gosh, we got to make sure that this is in every language that, you know, people will be able to access these same services. And so it's not something that you can add to someone's job, right? It's a full-time job to pay attention to these diversity and equity and inclusion issues. And as much as those, I would love to have that job, right? But I may not be the best person for it, but I'm certainly passionate about it. But as a fairly large organization, that demands a full-time position. Because, to Kathy's point, I have to start by looking internally at all of my own policies and procedures that are getting in the way of the things that I'm complaining about. And also to provide some leadership and do some additional partnerships with all of the other community partners out there.
I think for me, it's not just about creating a policy and having a new form or a new diversity group within organizations. It's really being an authentic self. And the only way that we can be authentic is if we have more people of color, clinicians of color, workers of color that are at the table to bring forth some of those issues and the ways that we practice differently. I think of a flyer being translated into Spanish. On one hand, it's great because we have something versus nothing. But on the other hand, we have to explain it. We have to create videos. We've used social media throughout this pandemic to show how to wash your hands appropriately, how to wear your mask appropriately, things like that. How can we be authentic in terms of inviting in that culture or that community and coming to their table, not having them come to our table? So that's one of the biggest things that we've been working on. Governor Whitmer has done great in terms of inviting us to her work plans. So for Services of Hope being at the behavioral health stakeholder meeting to see how our agencies were going to open, and then also being on the Latinx stakeholder meeting to see how we were going to translate materials in all of Michigan and all of the counties, and the work that the governor is doing with the migrant community in terms of the food that's coming to our table, and all of those essential people that are doing the work that we need in order to have our facilities continue to run and have food on our tables. So I think that's important, just to put ourselves out there. Lots of times it's easy to sit and complain and say these things aren't happening, but what are we doing about it? We have to stand up and we have to use our talents and treasures in order to continue, again, to move that work forward. And I think that's been the biggest thing, is not just having a thing or fixing the Band-Aid with just placing it on there, but really continuing to move it and not just having conversations, but doing something.
Thank you all for all of your thoughtful insights and answers. So we know that the health of our planet and the health of our communities are inextricably linked. So I was wondering what your perspective is on some of the environmental justice concerns and how that has played a role in some of the disproportionate impacts from COVID-19 and other health disparities on communities of color specifically. Kathy, would you like to start answering this question?
I'm sorry, can you repeat that for me?
Yeah, so I was asking, how do you think that some environmental justice concerns, whether it be, you know, air and water pollution, proximity to traffic, etc., has played a role in some of the disproportionate impacts on communities of color, specifically around COVID-19?
As far as COVID-19, so there are definitely environmental disadvantages that negatively impact individuals' health, and it does follow the environmental line of poverty, and there is a disproportionate amount of Black and brown people that fit that poverty guideline. What we find with COVID-19 in some of our investigation is when we call positive cases of Black and brown individuals and, ask if they can isolate within the home or if they can quarantine themselves, they are much more challenged than some of our other community residents because they are living in I don't want to call it congregate because it doesn't fit the definition of congregate, but they are living in very close quarters with the other household members. And it's not always close family members. Sometimes there's household members, temporary or transient, and they honestly want to comply with the isolation and quarantine orders, but they just don't have the space in the home. So they have to share a bathroom or they have to share a common space. Even some of the individuals, and we would say with the same income level, white, but if they're in the rural township and village areas, they actually have more space and they can still isolate, probably just a little bit better than some of ours. So for me, COVID-19, what we found with our investigations is not having enough environmental space at this time to socially distance and isolate and quarantine according to CDC and public health recommendations.
I would say those same rings true for myself. I think about our communities of color in terms of Black and brown families. We most often live in multi-generational families. So having essential workers going out to work and then having to return back with different levels of generations within one home. I also think about things like the pandemic pay. There was an increase on unemployment for those that were able to qualify. There was a large population that wasn't able to qualify for that. Those that did qualify, there were things happening like they were being shut off of Medicaid because now that put them in a different income bracket. So just paying attention to these things that we think are good, which they were good for a lot of the population, but then also remembering that there are pockets of people or others that essentially were hindered from the help.
I would sort of following up, particularly in Kathy's comments, the substandard housing issues remain today and get worse every day. Those disparities have been there as long as I've been in this business, like I said, 30 years, I'm sure longer than that. We just have more people of color living in substandard housing. We have more people that are impacted by their social needs because they're in substandard housing. And we know that we're at a crisis level in Muskegon County. We've got to do something about having affordable housing in order to impact people's health.
And I'll also like to add that there was a recent Harvard study that tied in particulate matter and air pollution into higher impacts of COVID cases. So specifically around communities of color, they're definitely more impacted by air pollution in a lot of ways. And I can send out the link to this study as well afterward to our attendees as well. But that's just another important point to elevate, is that a lot of the times our communities that are experiencing higher levels of COVID-19 are also experiencing high levels of pollution as well. But thank you all for your great answers. I'll pass it on along to Jocelyn.
I know we probably addressed this question a little bit in the prior question before the environmental one about, I know Alexis, you talked about more social determinants of people's health outcomes, and Kathy and Julia kind of pointed out, you know, policies and procedures that go into kind of health outcomes as well. Angelita pointed out, you know, hiring practices. But to get more specific, how can we address health inequities in our communities, businesses, and institutions, both holistically and collectively? And anybody can start.
I think it requires a collaborative effort, you know, from everyone, using the power of their voice, using the power of their vote, and using the power of their decisions. If you're in a position to make those key decisions, People of color have been weighed down with the oppression, of slavery and systems and all that for over 400 years. So it's also challenging for your Black population to even want to speak up, because there's just always a fear it doesn't make a difference. No one listens to me. My voice doesn't count, and it really does. And that's just an education right there that they need to know that it does. I think, the systems that are in place, there's just the fear that, Blacks, Latinx, Indian, Asian, whoever, might someday be on the same level as our Caucasian peers. And so there's just some fear there. So people have to get over the fear of that, of, being engaged with other people of color. Government, business, organizations, they need to have leadership that reflects all of the people that they represent, internally, externally. I believe that is really crucial right now, because you can make decisions and come up with policies and things, but if you haven't engaged the other people that you say you're trying to help, how can you really, make a difference, impact that, if you really don't have their input or you're not engaged with them in some way or another as well. And I think there's just, a lot of people, even with everything that's going on now, there's always the question, well, I just don't know, what I should do. And I'm afraid I'm going to say the wrong thing. There is no wrong thing if you're at least willing and, trying to understand and have a heart, of wanting to make a difference. There's no wrong thing. It's, if you're not sure, then ask someone. I think the key thing is having relationships with people of color. We discuss this in a lot of arenas too, is that people, they'll come in and do this work, and then they go back to their neighborhoods or silos, what have you, and there's no other interaction. They have no Latino friends or people of color that they engage with. They don't go to those events. So people really have to get involved. They have to be engaged, and they have to want to, to learn. So just quickly, I'll just mention that the Health Disparities Coalition will be offering some talking circles coming together on race coming up in the fall. And when you see that information, I encourage anyone, if you're new and not sure, hesitant, want to start, it's a good starting point. If you've already been part of this work and wanting to do more and make an impact and change in your communities and our businesses, then it's also for you too. So I encourage you to take advantage of those.
I would interject for myself. Muskegon County is still very black and white. They're really good at asking the race question, but they're not very good at asking the ethnicity question. And so when we think about the 51% cases that were white that were confirmed COVID, were they traditionally white, or what was their ethnicity? And I would beg to differ that 9% of Latino impact is a much higher rate. But we just didn't capture it because we didn't ask that ethnicity question. I'd also say that it's not good enough to go to trainings about racial disparities or feeling like we're culturally competent. When we have those things, it's a starter, it's a conversation starter for the individual to continue to do their own work and their own learning. When we have conversations like that, and we present information to our staff, sometimes the staff are like, yeah, I got it, this is great. But then also lump groups of people into a group. We have to remember that we need to treat all of our individuals and clients as individuals. They have their own culture of their home. They have their own culture and style of doing things and how they do provide their health and equity within their own families. And so just to be cognizant and respectful of those things and not to lump because we went to a training.
Mentioned earlier that I thought we could build off of the work that this community has started with ACEs and how do you build resiliency. We should be asking, we should mostly be listening to people right now. Alexis spoke about some of the efforts going on inside of Hackley Community Care. We've done some similar things, having listening sessions and trying to create a safe space for people to talk and for some people to learn, right? And so that we can address these issues in a holistic manner, in a different manner, break some of the bad habits that we have in the ways that we act. those lessons learned, though, listening to people, really listening to people, and asking what's happened to you, right? Tell me your story. I think takes us very far forward in this conversation. It's not just a checklist. You know, this community's tried a lot of things. They're not bad. They haven't moved us far enough, right? Let's do a checklist of social determinants of health and what are your needs, and let's meet that need. And it's just more complicated than that, right? It's not one thing. When we looked at those social determinants and some of the early work that the Shire did, I think they were surprised at the data because they thought they would see transportation higher on the list, right? Part of it is that we asked the questions the wrong way when we were trying to solve the problem before we even understood what the problem was. And so we have to create a mechanism to truly listen to people and what that proper solution is going to be, or what that right solution is going to be in order to meet the need. I struggle with this, and we talk about it. Many of us talk about this all the time. But I think the biggest issue is that the leaders in the organization, and I know there's some business members on this, it's not for us to fix, right? It's not for us to go in and say, this is how we're going to create a fix. We have to allow people to tell us what's going to work and how do we help solve and meet their needs. And somehow we've got to turn this upside down, the way that we are approaching the social determinants of health.
Kathy, do you have anything that you would like to add?
I agree with all the panelists. Yes, it is. I think we have to recognize that our physical health is a small component. The social influences or the social conditions of the individuals really influence 80% of an individual's health. The genetic, hereditary, physical, and other qualities is only 20%. And I do think that, as we plan to serve, to hire, that we have to understand that everybody is in a different state social economically. And it's really hard to design a program or an approach, a one-size-fits-all program or approach. If money or resources was not a factor, I would say every business needs an individual that works within the workplace that is available to help their workers, and they don't necessarily have to be minority workers. They have to be workers that's struggling with social influences or social determinants of health that is really impacting their personal health and their productivity at work. It has to be a collaborative effort and a deliberate effort and a conscious effort among everyone. And I don't know how to get there. I really don't. But I think, I think it's well worth a try.
Well, unfortunately, we are out of time, but if you all who are still on the line today have any other questions, feel free. I'll drop my email in the chat if you have any other questions for our panelists, and maybe I can send them along to them to be answered. But I would like to thank you all for your time and your knowledge and sharing your expertise to all of our panelists on the chat today, and for all of our attendees as well. I'd like to thank everyone. So if you found our talk valuable today, please consider to become a member of the Lakeshore Sustainability Forum or the Michigan Sustainable Business Forum as well. And you can also check out our website for more upcoming webinars and other opportunities at wmsbf.org. Please contact us to get involved with some of our Lakeshore sustainability initiatives and our communities as well. And thank you so much again, and we will keep in touch. Have a great day.
Yep,
for
thanks
coming.
everyone.